Hey guys, it's Lauren and I'm here to talk to you about syphilis. So there are many signs and symptoms of syphilis depending on what stage you have, and these stages can include primary, secondary, latency, and tertiary syphilis. The first notable sign of syphilis is in the primary stage and is a canker at the site of entry of the pathogen. This canker appears after a period of 9 to 90 days or after the bacteria has had time to incubate. These painless bacteria-filled bumps can appear at many different portals of entry and exit and include the erogenous zones, genitalia, oral cavity, and lips. During this stage, lymph nodes become swollen and the canker disappears, letting the virus into circulation and leading to the secondary stage. This stage occurs 3 weeks to 6 months after the canker heals, and by then the body is invaded by the bacteria, and the signs and symptoms are a lot more pronounced. The symptoms of secondary syphilis include fever, headache, sore throat, lymphadenopathy, and a rash that breaks out on all skin surfaces of the body. The lesions that accompany this rash are highly infectious as they contain the bacteria in really large amounts. Major complications occur in this stage, affecting the bones, hair follicles, joints, liver, eyes, and brain for months to even life. After the secondary stage, the disease enters the latency stage, and this period can last for 20 or more years. If the disease continues to progress from that point, it will enter the tertiary stage, and although this stage is really rarely reached today because of the use of antibiotics, it's really damaging to the body if it is reached, because this stage of syphilis can attack the heart, causing failure. It attacks the tissues by tumors, and it attacks the nervous system. The Treponema pallidum bacteria causes syphilis, the T. pallidum bacteria. It is a gram-negative spirochete bacterium with complex growth requirements, meaning that it needs a host, and more specifically, human, I believe, to survive. T. pallidum is a fierce bacterium that can infect the host through direct contact of mucous membranes and abraded skin. After hooking into the epithelium, the spirochete multiplies and penetrates into the body's circulatory system. Any tissue can be a target once the bacteria has made its way into the body, and the disease is of high virulence due to the fact that it progresses in such a way as to damage and shut down so many tissues, organs, and systems. Although the disease is highly transmissible in the primary and secondary stages, it is largely non-transmissible in the latent and tertiary stages. And there is another type of syphilis. It's called congenital syphilis. So let's talk about that for a second. If somebody gets pregnant or if a mother gives birth with syphilis, it can pass down congenital syphilis to her baby. And the signs include the snuffles and defects such as malformations of the nose, forehead, and hard palate, and this can go with the child through life. Syphilis is detected most rapidly through dark field microscopy. Wet mounts are then used to observe the bacterium and confirm the presence of T. pallidum. Diagnosis of syphilis can be difficult because stages mimic each other and the symptoms can be hard to tell from other diseases. An example of this would be the lesions and canker can be hard to differentiate from other types of infectious fungus, STIs, and even allergic reactions. But to reach a diagnosis, a blood test is required to detect the antibodies formed in response to the T. pallidum infection. Finally, the prevention of syphilis starts with the education of the community and the reporting of infected patients. Prevention is mainly in the hands of those who are sexually active, making sure that protective barriers, such as condoms and dental dams, are used correctly and every time a sex act is performed. Treatment of syphilis includes the use of antibiotics such as penicillin, tetracycline, and doxycycline. So if you have any other questions, be sure to ask me. So thank you.